Hi, I'm Dr. Victoria Mondloch. Thanks for watching Hey Doc, What's Up? And thank you for watching me on Brilliant Joy TV and Roku. Today, what I'm going to talk about is the first leg of the 4 foundational legs of your hormone chair. Remember, last time what we talked about is that there are the 4 foundational groups, like 4 legs of a chair in your hormone chair. Those are the foundations of your health. So that first leg of your chair is actually your female hormone. And that female hormone is what gives us our periods when we have our menstrual career, and it's what goes away for us when we go through menopause. But those hormones are extremely important for our health and our well-being while we are in our menstrual career. And believe it or not, they're actually really important once we hit menopause. So let's dive in. Now, women, we have more than just women's hormones. We have male hormone too. So when we have to balance our female and our male hormones, we have 4 hormones that we have to balance. Our estradiol, our progesterone as our female hormones, and our total and free testosterone as our male hormones. Guys have it a little easier. They're only managing and balancing their total and free testosterone. But we have to manage all 4. So what does that look like? Well, believe it or not, nobody knew what the curve of what female hormone levels should be until I actually did 20 years of consented research on my own patients. What that means is my patients gave me permission to actually follow and check their hormone levels over time. And I developed the graphs of what those hormone levels should look like. Where can you find that information? Well, believe it or not, that information is actually available in my books, and that's why I'm so excited to be able to share this information with you. So again, first leg of your chair is your female and your male hormone levels. So in adolescence, they go up and down and up and down, and they swing quite a bit. And that swing is kind of like starting your car in the winter. Starts rough, and you may not have regular cycles as an adolescent, but over the first couple of years, your periods and your cycles will usually even out. But many times, that's just the beginning of it. Are some teens more emotional in 1 month than another? Do some teens get menstrual migraines where other teens don't? Do some teens actually get abdominal bloating? Do they build into these symptoms as they go through adolescence? And then what happens when they hit their 20s and their 30s? Are there some teens that actually are showing some of the signs of things that are to come that may not show up until their 20s and 30s? These are all great questions. And these are all questions that are just needing to be answered because each individual person is different. So it begs the question, where are my hormone levels? Well, unless you have them checked, how would you know? So again, in the adolescent, the myth that is out there is that all adolescents start rough, but all adolescents will get regular cycles. Myth or truth? Myth, because we all have genetically different makeup, and we all are going to either be prone to things like endometriosis, prone to fibroids, prone to polycystic ovary, and many of those diagnoses are actually an imbalance in our female hormones. It means we may have more estradiol than progesterone. That's an imbalance. It's like riding in your car and your tires are out of balance. You're going to feel the thud as you go down the road. Well, you want those tires balanced. You want those hormone levels balanced. That's what's going to give you regular cycling, predictable amounts of flow with your period, less likelihood that you're going to be prone to some of these diagnoses like endometriosis or fibroids as you go forward. So what does that look like, getting your hormone levels checked? Well, what it means is that you actually have to have the week before your cycle is due. That is when you peak in both of your female hormones. That's your peak in estradiol and your peak in progesterone. And if you're not balanced and that day 21 is showing that you're maybe having a lower progesterone than your estradiol, that's your estrogen dominance. If you do that month after month after month, that means you may be giving yourself endometriosis without even knowing it. And that's the intensity of the cramps that you get with your period. What is your doctor going to say when you go in and say, my daughter has these cramps, or you as the adolescent is telling the doctor, I have these terrible cramps? Well, doctors aren't taught to check your levels. So they simply say, well, we'll put you on the pill. But doc, I don't want to go on the pill. I want to know what's going on. Why do I get bad cramps, but my sister doesn't, or my best girlfriend doesn't? Well, these are great questions, but you know what? They don't teach this in medical school. And you would think, whoa, wait a minute. What do you mean they don't teach this in medical school? Well, they don't. And so the whole idea of knowing where your hormones are, number one, whether you're in balance, number two, is actually information that you now know that your doctor may not. So I'm going to share with you that you can get this information all on your own by simply getting the right resource information. And that's my book, Blossoming, Becoming a Woman. This is the adolescent guide to where your hormones should be if they are properly balanced. And I'm going to talk about where those numbers should be, what that looks like as a change in symptoms, what exercise, what diet. I'm going to go through the research. I'm going to go through case studies, but more importantly, there's a chapter at the end of the book that says, how do I talk to my healthcare provider? Wow. Isn't that what we all want? Is how to have a great conversation with your healthcare providers so they know what your symptoms are and where you're coming from when you say, I have migraines before my period, or I'm having heavy periods. They should be able to look at you and say, your hormones are out of balance. Let's recheck your levels and see where they are. So that's adolescence. Now, going into your 20s and 30s, those are the years where you're at the top of the bell curve of your female hormone. And that bell curve is going to be at that 90th, 100th percentile for your estradiol and your progesterone. For women that are balanced, they're going to have those regular periods. PMS is going to be manageable. Cramps are going to be manageable. And that's what all of us want, but that's not what all of us are going to get. So if you're already in adolescence out of balance, the likelihood that you're going to continue to be out of balance is actually quite high. So if you're estrogen dominant in adolescence, guess what? You're likely going to be estrogen dominant in your 20s and in your 30s. Well, that's when you're building extra lining outside your uterus, giving you those heavy cramps. That's endometriosis, which can cause scar tissue, which can cause incredible cramping to the point that some people actually go on narcotics for the level of cramping they get. But in particular, that scar tissue can cause an increased risk of ectopic pregnancy or even infertility. That now you have scar tissue that doesn't allow the egg and the sperm to meet, and you are now infertile. You are now unable to have a possible family starting. And so that's the situation where if you would have known 10 or 15 years beforehand, you might have been in a position to manage this condition. Instead of it's a surprise. Oh my gosh, your hormones are out of balance. And oh my gosh, you have a diagnosis that I have to do surgery on. Well, wait a minute. What do you mean I need surgery? That shouldn't be a surprise to any woman hearing this in their late 20s or 30s. Yet so many times it is that surprise. So in particular, then, what about the woman with infertility? What if you think you can just simply start your family 2 to 3 years before age 35 and you will have your ideal family, everything will go well? What if that scenario doesn't happen? You're unable to actually get pregnant. Well, many times what you get faced with is, well, we can send you to the specialist, and the specialist is going to be able to help you get pregnant. But that's going to be an out-of-pocket cost for most patients, and the cost can be quite prohibitive, to the tune of $10,000 to $12,000 a cycle. And that's usually not something that people budget for because you don't think it's ever going to happen to you. So you really want to put yourself in a position to know where your hormone levels are so you can be your best advocate for your own health. And you can be in charge of the timing of when you try to have family. And you can be in charge of the process that you're going to follow in order to try to start your family. So that's your 30s and your 40s. A little bit different than what you might be envisioning. But now the woman in their 40s, you've been successful at your job for maybe 15, 20 years. Now what's happening is your female hormones are starting to swing, and they're going from that 90th, 100th percentile in your 20s, 30s, and they're now swinging on their way down. And that swing is actually a mirror image to what happens in adolescence. If you average that, that becomes the bell curve. But what happens in each individual woman is going to be much different with different levels of swing for what's measured in their bloodstream. So you need to know what are some of the symptoms that can happen when your hormones swing. Well, you may not remember adolescence. Now you've gone through 10, 15, maybe 20 years of normal, good, 90th to 100% hormone levels. Now those levels are changing and dropping on you. Some months better levels, some months not so good levels. You're going to notice those as more PMS, as insomnia, as some short-term memory loss, as a change in migraines, as increased acid reflux, muscular aches, joint pain, bladder incontinence, things that you wouldn't necessarily think of as perimenopause in your 40s. You're thinking, oh my gosh, that happens to my mother. That happens to my grandmother. That happens to women in menopause. Well, I've got news for you, ladies. As you swing, you may be starting to have some of the early signs and symptoms of that before you ever get to menopause. So how can you manage where 1 month you know the names of your clients at work, you know what your job at work is, you have no hesitation. The next month, you look your best friend or your best client in the eye, and you can't recall their name. So don't be caught unawares. Realize knowing where your hormone levels are is your best defense against explaining your symptoms, against having anything untoward happen to you at the job site. You don't want your boss looking at your job performance that happens to be a low estradiol month when your short-term memory is not at its best. You've worked hard for this job. You know this job. You have the carnal wisdom of this job that is going to be far and above what any new employee coming in is going to have, yet you. And then women, once you hit menopause, we are given such disinformation about the health of hormone to our well-being, to our body. Estradiol, the main female hormone, actually has the physiologic function in your body. It's responsible for blood supply per square inch to organs in your body with estradiol receptors. So again, it's responsible for blood supply per square inch. So what happens when we decrease that estradiol amount? Well, I'm sad to say we actually decrease the blood supply per square inch to those organ systems. Again, which organ systems? Every single one in your body, from your hair to your skin, to your muscles, to your joints, to your GI tract, to your heart, to your lungs. You name it, that system is going to have an impact. So, holy smokes, that's not fair. Men don't lose their hormone level at the same rate women do. You're absolutely right. They don't. They still will have a decreased curve, but I'm going to tell you something that you may not know, is menopause is only about 100 years old. Well, wait a minute. Women have been around for decades, for centuries. What do you mean it's only 100 years old? Well, the average lifespan of the American female in 1912 was 48 and a half years old. We never made it to menopause. Menopause wasn't an issue. It wasn't something we had to worry about because it didn't happen. It didn't exist. We didn't get there. Now, with the advent of so many things in modern medicine, not only do we get there, but we may spend as many years after age 50 without natural hormone as we did before age 50 with natural hormone. Puberty starting at age 12, menopause at age 50, that's 38 years with hormone. Age 50 to age 88 is 38 years without hormone. So what happens when we have no estradiol in our system, which means decreased blood supply per square inch? Well, there's your increased risk of breast cancer, far different than what you hear. That's part of the disinformation campaign that women are told about hormone and lack of hormone in menopausal years. It's still our lifeblood. It's still important. We still have to balance it with our other female hormone, progesterone, because if you don't, you are at increased risk of cancer. You are at increased risk of heart disease. You are at increased risk of stroke. And believe it or not, without adequate female hormone, especially estradiol and the balance of estradiol progesterone, you are actually at risk for Alzheimer's. And nobody ever tells you that either. So one of the most important things is know what you need to know. And that's why for the adolescent woman, it is all about blossoming. And blossoming as the adolescent book written as a mother-daughter guide. For the perimenopause, menopause, postmenopausal woman, it's full bloom. And it's all about what are the myths and the truth, and how do we actually get disinformation dispelled? How do we learn what the research really is and what it's trying to tell us, and how we can best protect our health? How can we best protect our mind from Alzheimer's? How can we keep ourselves forever age 45? That's a thing. It is. And it's all about properly balanced female hormone, and balanced more female than male. Another piece of information many women have no idea is that when women go into menopause, they actually drop their female hormone without replacement. And what takes over? Male hormone. What? We actually become more male than female. Did you ever hear of your grandmother plucking hair from her upper lip? Do you ever hear about women or see women like your grandmother with thinning hair on the top of their head? That's male pattern baldness, male pattern hair growth. There are women that in menopause might actually have to bring out a shaver and shave. And the worst part of it is that with excess testosterone, we develop the same abdominal extra weight that men do. And that extra abdominal weight takes some of that fat and turns it into a form of estrogen that's very weak called estrone, but some of that estrone converts to estradiol. And you say, well, good, then I've got postmenopausal estradiol. But if you're estrogen dominant in menopause for 15, 20 years, that puts you at a much higher risk of cancer of the breast. And that's the menopausal breast cancer that you'll be told, oh, but that's easy for us to treat. We just do your surgery, we do chemo, we do radiation, and it'll never come back on you. And your thought is, well, wait a minute, I never wanted it in the first place. So why didn't you let me know that I was going to be estrogen dominant in menopause, that was my increased risk? Why didn't somebody tell me? And you're very, very correct in asking that question. Medicine doesn't teach this to their doctors in medical school. Why? Because American research differs from European research. They actually studied the effects of hormone in menopause, and American research came up with the opposite results that European research came up with. Well, how can that be? Well, again, I outline it in the books, but it's basically that European research, which said you'll get a decrease in breast cancer, decrease in heart attack, decrease in stroke, with a decrease in osteoporosis, decrease in Alzheimer's. That research in Europe was done with human-based bioidentical hormone, what our ovaries would normally make. What did American research study? Well, they actually studied the chemical Premarin, which stands for pregnant mare's urine. Wait a minute, horse urine? That's right. And Prem Pro, which is Premarin plus a chemical synthetic medroxyprogesterone acetate, which in the fine print in the medication insert that you read actually says that it is associated with infertility and increased risk of breast cancer. Oh, and by the way, that Provera shot, that contraception shot, the most common contraceptive on every college campus in the US. Guess what's in the contraceptive shot? The same medroxyprogesterone acetate that gave the results in American research to show increased risk of cancer of the breast, increased heart attack, increased stroke. Wait a minute. You mean my contraceptive I took in college may actually give me a higher risk sooner of breast cancer and cause me infertility? That's exactly what I'm saying. Well, why didn't somebody tell me? Isn't that a great question? So, women, I'm trying to dispel the myths and tell you the truths about hormone. That's our lifeblood. And that's just the female hormone. Realize there's a genetic condition that about 15 to 20% of women go through in their menstrual career, where they actually are some months more male, some months more female. What? That's called polycystic ovary disease. And those patients act perimenopausal their entire menstrual career. And they flip between having more male hormone some months, more female hormone other months. And so imagine the schizophrenic nature of how you would feel if some months you're more male-like with all of the increased mid-abdominal weight, increased facial hair growth, decrease in thinning hair, and all that goes with excess testosterone. But other months, you're more female. So your body doesn't really know which end is up. And that, ladies, is genetic. And some women are going to get more of those genes and have a stronger tendency for those symptoms of more male to show up earlier than other women. We don't even know how many genes are involved in polycystic ovary, but we do know that some of those genes are also associated with an increased risk of insulin resistance or prediabetes. Oh my goodness. So you see, there's a lot to unpack with what our female hormones are telling us and what a balance versus an imbalance in your hormone levels are. So my best advice to you is you need to know what you don't know. And that means education. That means empowerment. That means look for the resources that are going to give you those answers. For the adolescent, it's Blossoming, Becoming a Woman, a Mother-Daughter Guide. For the perimenopause, menopause, postmenopausal woman, it is Full Bloom. And Full Bloom is going to, again, give you the truths and the research about what really happens during these changing hormone level years of your 40s, 50s, and beyond. So again, know that this information is information your doctor may not have. So you need to advocate for yourselves. You need to go to the last chapter in both books and let them know, because the chapter is called How to Talk to Your Healthcare Provider. Say, these are the labs I want drawn, and this is why. Oh, and by the way, Doc, I'm going to leave with you my copy of the book because I'm sure you're going to want to read this, because I'd like to talk to you about it the next time I come in. And you now are going to be an advocate for your own health. What if your doctor won't draw your labs? What if your doctor is one of the 77% of healthcare providers in this country that actually works for a hospital or for an insurance company, and they cannot order hormone blood tests for you because their boss, the hospital administrator or the insurance company administrator, says you can't go there? Well, know that you can order your own labs. What? I don't need a doctor's order? No, you can order your own labs that your doctor is unable to order for you. There are 2 national labs that you can go to online. Quest is one, Quest, and your insurance may already cover Quest. But the second lab is an actual subsidiary of LabCorp, another national lab called Life Extensions. You can go online, order the labs that your doctor is unable to order for you, pay for them online. You therefore enter your zip code and it tells you the draw station closest to where you live. You go in and get drawn, present your receipt, and they will draw you. And they're going to ask you, where do you want your blood levels to go? Well, you want them to go back to you. That way you are in control of your lab values, and you can take them to your doctor. You can take them to a second opinion. You can take them to a naturopath. You choose whom you want to partner in your healthcare with. And if you want a second opinion, you're in control of those blood values, so you can have an honest discussion with a second opinion healthcare provider. So ladies, what I'm telling you is be educated, be empowered, and know that this is information that is vital for you to know, to understand not just your health today, but your health in 5 years, in 10 years, in 15 years, whether or not you're going to be able to have an easy or a hard time starting your family, whether or not once you hit menopause, can you actually turn back the hands of time, and can you feel 15 to 20 years younger than your stated age? And I'm going to tell you, you can do all of that. You simply need to be educated and empowered. So know that these books, Blossoming and Full Bloom, are available on Amazon. And Amazon, you just put in the names of the books or put in my name, Dr. Victoria Mondloch, and you'll see the books, download, read, and keep them as a resource, because this is going to be helpful to you in all your ages and stages of your female journey. So again, thank you so much for joining me on Hey Doc, What's Up? Next time, what we're going to do is talk about the second leg of your hormone chair. And that leg is going to be just as important as this first leg. But this first leg is a leg nobody talks about: your female-male hormone balance and how that changes